to save everyone, okay, just to save everyone time, I would like to welcome Dr. Philip Clay, Food and Agriculture Organization Regional Office for Asia and the Pacific. He is the lead of One Health in Agri-Food System and followed by Dr. Thongkorn Miyam, SEAOHUN Executive Director. Now it is my great pleasure to invite one of our speakers for the opening remark. Dr. Philip and Dr. Thongkorn, the floor is yours.
Thank you so much. I hear myself. Is this better? Just a moment. Okay. Can you hear me?
Yes.
Okay. Good afternoon. Thank you all for the opportunity to join this important webinar and the launch of the One Health Campus to Community Challenge. I would like to start by recognizing SEAOHUN and in particular Dr. Thongkorn Miyam, SEAOHUN Executive Director, all the speakers today and all the partners for convening this platform and for the leadership in strengthening One Health collaboration across Southeast Asia. This webinar is not just about introducing a competition, but it actually represents a broader shift from knowledge into action. From our FAO perspective, students, you're not just our future, you're also part of the system that will shape our regional health security. As we all know, Southeast Asia continues to have complex and evolving health challenges driven by close interactions between humans, animals, and ecosystems. We have big changes in agri-food systems, production practices, but also a lot of pressure from the environment and climate change. As a result, all these risks, for example, zoonotic diseases, food safety threats, and ecosystem disruptions, they're all becoming more interconnected, and that's why a One Health approach is essential to tackle these challenges. One of the big key challenges that is remaining is translating knowledge into practical community-based action. Many of our strong ideas actually remain within classrooms, somewhere in academia, without actually testing them or implementing them in real-world settings. So therefore, we really think that this One Health Campus to Community Challenge will really directly address this issue. It will create an opportunity for students to move beyond theory, work across disciplines, engage directly with other communities, and design solutions that will be practical and actually implemented in real life. Of course, all this aligns very strongly with FAO's work across the region in terms of animal health, like how can we support countries through strengthened surveillance, work on prevention and response systems for infectious diseases and antimicrobial resistance. It will help with zoonotic disease prevention. How can we focus on reducing risks at the human-animal environment, including such as livestock systems and wildlife markets? And of course, it also addresses One Health in terms of how can we work with different partners and stakeholders to strengthen our coordination across sectors. And last but not least, for FAO, how can we work on better agri-food systems? How can we promote approaches that are actually safe, resilient, and sustainable within the region? Across all these areas, one factor is identified as a critical gap, and that's the availability of skilled and connected professionals. So that's where we think that our collaboration as FAO with SEAOHUN becomes very important. Through this partnership, we aim to support the development of practical competencies, strengthen regional networks, and connect students with real-world programs and platforms. For the students participating in this initiative, I would encourage you all to start with real community problems, work collaboratively across disciplines, and actually design solutions that are feasible and context-specific and to give a meaningful impact, starting with small, well-designed actions. In closing, I would like to say that FAO remains fully committed to our collaboration with SEAOHUN across these initiatives and many others. Our shared goal is to support a new generation of One Health professionals who can move from knowledge to action, because in the end, the strength of our system depends on people. People that can think critically, that can collaborate effectively, and can act decisively. And that will include, hopefully, all of you in the future. Thank you for listening.
Thank you so much, Dr. Philip Clay. So followed by Dr. Tong Goniam. The floor is yours.
Thank you so much. Thank you, Philip, for joining the webinars today. I think today is not just the launching of the SEAOHUN webinar series, but we also celebrating our first activity after successfully signing MOU with FAO. So let's start celebrating these events also. And good evening, everyone, and warm welcome to our SEAOHUN webinars as we officially launch SEAOHUN 2026, a regional student competition. So we are delighted to have all of you here, students, educators, partners joining us for these exciting sessions. So today's the webinar is designed to help you bridging the gap between academic learning and practical impact. As One Health, as you are future One Health leaders, the ideas you develop, the teamwork you engage in, and the curiosity you bring to this competition have the power to drive a meaningful change in your community and beyond. So we are honored to be joined by speakers who will share the One Health landscape in Southeast Asia, share insight on the project proposal writing, and inspire you with some example of how One Health principle can be applied in the real world setting. So the expertise will be invaluable as you will prepare for the competitions. So this competition is more than just the academic exercise. It is an opportunity for you to transform knowledge into actions, use or exercise your leadership, and contribute the solution that matters to the community. So we hope today's session will spark the new ideas, motivate you to participate, and empower you to take the next step in your One Health journey. So thank you to our speakers. So all the speakers, partners, including FAO and SEAOHUN, Malaysia One Health University Network, and also a country One Health University Network from every country. Also, special thanks to Chevron for their general support as always. That give us a chance to expanding not just in Southeast Asia, we're expanding this competition to South Asia and India and Bangladesh also. And thank you for all the students joining us today. Your engagement is what truly bring this initiative to life. And once again, welcome, and I wish you an inspiring and productive webinar ahead. Thank you so much.
Thank you so much, Dr. Tongkon. So now we may need to snap, some photos. So Tura, can I over to you for the cameraman today?
Yeah, happy to do that. Okay, if you're okay, can you please turn on your video and make a pose, smile, so that I can take a photo for our beautiful webinar record. I will count 1, 2, 3 when I take. This is just for you to have prepared, because sometimes we're joining, like this is like after 5 p.m. in Thailand. So maybe you are in different setting on the way or at your house. So please take your time to open your video camera so that I can start take the beautiful picture. Okay, I'm seeing more and more people.
Please, guy. I can see your face now as the power of youth. All right, so Tura, are we ready?
Okay. We need few more people. even for the first page. So if you're okay, can you please join? Okay, I will start to take the first photo just to test while we are waiting for a few more people. Okay, I just take the first picture. So we have 3 pages. Okay, I need more people. Please, more people, please join. This is a moment that you join this very useful webinar, and so that you can continue for your project in case you are applying. Okay, I think we are good for the first page while we are waiting for other people. So I'm gonna start to take the first picture. Please smile, make a pose if you want. Okay, I'm going to take one. I'm going to take 1, 2, 3. Okay. I finished the first
Slides.
photo.
Okay.
Let's see the second page. Okay, I think some people are not okay to open the video camera. That's okay. Anyway, I will just take the picture of the another 2 pages. Okay, I'm taking one more picture. Okay, and then let me paste one more, please wait. So this is the third page. Going to third page. Okay, I think we're all good. Thank you so much, everyone, for joining this photo session. Over,
Thank you so much. Thank you, Tura, for helping. So let me switch my camera. Again, so many camera in here. So, all right. So welcome everyone again. So just to save everyone time, we will share you a panelist today. So our panelists today, we were talking about One Health in Southeast Asia by Ms. Manon, Project Coordinator of the Sustainable Wildlife Management Program in the Asia Pacific at FAO, and followed by the idea to action from Dr. Thongkorn Meyam, SEAOHUN Executive Director, to share her insight and practical guidance on how you could write a strong One Health proposal. This one couldn't be missed. And the last but not least of the panelists today will be Dr. Nur Indah Ahmed. So she is coordinator of Malaysia One Health University Network on SEAOHUN. She'll come to speak and show you the example of One Health in action, with her life experience working with the One Health Student Club. I already have seen some of the photos. Very excited to hear from you as well. So I will stop it here, and then let me please welcome Ms. Manon to the panel. Ms. Manon, the floor is yours.
Thank you so much. Good afternoon, everyone. I'll just share my screen. Please let me know when it comes up and if you can hear me well.
Wonderful.
Wonderful, great. So good afternoon, good evening, everyone. Thank you so much for having me. I'm very honored. My name is Manon, and I coordinate wildlife work in Asia and the Pacific on behalf of the Food and Agriculture Organization. It's a discipline that integrates many different facets of balancing conservation and rural development and livelihoods. And I work very closely with our FAO colleagues in the wildlife and animal health sectors as well. Today, I'm going to take you on a quick journey through some of the biggest health challenges that we're facing in our region. And that sit right there at the intersection of human health, wildlife health, and the environment. And how you, as the next generation of One Health practitioners, you can play a role in developing the solutions of tomorrow. Why you? Because you and I are here together at the center of one of the most important zoonotic hotspots in the world. This is a map from 2017, and there have been many since, as you can imagine, since we went through the COVID-19 crisis. But all of these maps essentially show the same thing. The risks of zoonotic disease emergence in our region is alarming. Some of you may have seen, we had another webinar this morning on the Nipah virus outbreak in India. Or news that come out from time to time about the human highly pathogenic avian influenza cases that arise in humans. Our region is particularly vulnerable, and I'm going to get into reasons of that a little bit later. Most of you here already, I would assume, are going to be familiar with this, how pathogens move from animals to humans, sometimes how local outbreaks can devolve into global pandemics. It starts with pathogens in animal reservoirs, a bat, a bird, a rodent, a monkey, somewhere in the forest, on the outskirts of fields. It can be truly anywhere. Under the right set of conditions, that pathogen sometimes spills over into other species, and sometimes it spills over into human populations. Sometimes it stops there, but sometimes, as we saw so dramatically in the past with previous epidemics and pandemics, it spills and it spreads into human populations. The good news is if we understand these pathways and if we work together, truly work together, we can interrupt these pathways. And that's what One Health is all about. My work focuses particularly at the human and wildlife interfaces. These are very complex, and the reasons behind zoonotic disease emergence are deeply rooted into our relationships with nature and wildlife. As we drive agricultural intensification, our natural habitats become more and more fragmented. Wildlife populations become closer and closer in contact with humans. This is also the case when wildlife trade, whether that's legal or illegal. Many of you will hear about rhino horns being smuggled through borders, but there's a big part of wildlife trade that's simply people going to hunt for meat in the forests and sometimes selling that meat or selling live animals. It takes so many different versions. As we lose biodiversity and we reduce these interfaces between people and humans, people and wildlife, we also drive the risk of these reservoir species coming into closer contact with us. Climate change and global trade routes also exacerbate this problem. So these interfaces get smaller and more contact is made, more interactions, and they get taken away a lot more easily into global trade patterns. All of these drive the risk of zoonotic disease emergence and potential infections. So we need to be very cognizant of the root causes and the sources and how we take action at the source to prevent these future pandemics. In my work through the Sustainable Wildlife Management Program, we work directly at these interfaces and we ask questions like, how are communities interacting with wildlife? Do they depend on them for food or livelihoods? What are the drivers that push people deeper into the forests and potentially into contact with these animals? And how can we support more sustainable livelihoods that also reduce the risk of zoonotic disease spillover? A little bit more context. This emerged from a recent global systematic review in 2025 that looked specifically into the most researched zoonotic hosts in Southeast Asia. And they identified three main families of animals that were being researched prominently in our region. And those tend to be non-human primates, bats, and rodents. Those are especially researched and considered as especially risky species. And on the right here, you have maps of species richness and sorry about that. And disease likelihoods, particularly zoonotic diseases, in different animals. So you see on the top left here are carnivores. You see bats on the top right-hand side. That's big hotspot in our region. Consistently, you see quite big risks aside from ungulates that are not as present in our region. There are also threats that are less visible, but in many ways, they can be even more dangerous in the long run. Antimicrobial resistance builds quietly in farms, in water systems, in hospitals, until the drugs that we rely on to treat infections can actually stop working. We estimate globally that 75 to 90% of antibiotics that are given to domestic animals are excreted completely unmetabolized. They pass through the animals' bodies and spread directly into water and sewage systems, into the soil, into the water we drink, and into the food that we eat. In Southeast Asia, where livestock production has really grown in the past few years, as our populations have also grown, we're using more and more antibiotics in our farming systems, and the risks are getting increasingly high. FAO works to tackle this on multiple fronts, from supporting better farming practices like vaccination, biosecurity, to reduce the need for antibiotics in the first place, but also building things like surveillance systems to track how resistance is spreading, and working with governments on legislative reforms, as well as running awareness campaigns so that people know what practices they need to be aware of and what the risks are. That's a problem that requires action at every level. And you definitely have a role to play. So we have zoonotic risks, we have AMR, we know that nature and agri-food systems are under pressure. They're not separate problems. They're all interconnected, and as they're interconnected, they require connected solutions. And that's where One Health comes in. I'm really not telling you anything you don't already know, I suppose. But this is the way we think about One Health in FAO. We're guided through these two core principles to prevent, detect, and prepare for the next disease outbreak or AMR spread. Oh, sorry about that. In practice, what does that look like? What do we do? So our approach in the region rests on three different things. We provide technical support to mitigate those risks. That means joint risk assessments, outbreak investigations, strengthening laboratories, providing biosecurity guidance at farming and wildlife farming establishments, analyzing value chains for where there might be at-risk nodes or practices. We develop capacities because tools and policies only work if people know how to use them. So we have trained field epidemiologists, veterinarians, lab technicians, and particularly forest rangers and community guards at the community level. So they're often the first ones to notice that something is going on in wildlife populations or at the fringes of the human-wildlife interface I talked about earlier. They're often the first ones that would be able to sound the alarm if something goes wrong. And third, we work on evidence-based policy and advocacy. We work with governments to strengthen legal and policy frameworks to ensure that sectors are talking to each other and effectively coordinating action and prevention. We support the ASEAN One Health Joint Plan of Action, but also other ASEAN bodies like the Southeast Asia One Health University Network and other partners. We also work at global level with other organizations to provide the leadership necessary to advise governments and global action to prepare for the next pandemic. I want to talk a little bit about what we're here for today. And we've seen, especially firsthand at FAO, the power of working with communities. It's not only that it's an effective thing to do, it's that it's the right thing to do. Very often, across the world, we see decisions are being taken in boardrooms and in the capital cities very far away from the field realities. They are centralized. Either people are not willing to consult others or they have limited means to do so. And very often, the people on the front lines will be left out of the decisions entirely. It's not only ineffective, it's unjust. The most vulnerable populations in our region are living at these human-wildlife interfaces. They need to be involved in the decision-making. So anything we can do to bridge that gap between the field reality and the policy-making and decision-making is going to be a good thing. It allows us to get closer to the source and to get closer to how we can actually and effectively prevent disease risks. We need to understand how communities participate in or are affected by different drivers, like deforestation, hunting, smallholder production, and any other at-risk practices. What are their exposure to pathogens, and how can we effectively work with them to decrease those risks, make them allies in the process? And also in that process, making people's lives better. It's a win-win solution. It's easy to say, it's hard to do. But critically, and I spoke about it a little bit earlier, communities are sentinels. They are the first ones who are going to be able to detect that something is wrong, particularly when we're talking about new pathogens, unknown pathogens that we might detect in wildlife. Very often, forest rangers are the first ones to be able to see that, but they either don't know how to report it or they don't know what they're dealing with. So these are essential conversations to have to make sure that this gets reported at the right time and early enough that we can take effective action before it becomes more of a problem. I'll leave that here for a few seconds. I'm not going to bore you. FAO has a lot of tools and methodologies and other learning opportunities that you might be interested in. So I've just popped here 2 QR codes that you can feel free to take a picture, or otherwise I'm sure these slides will be shared later for your understanding. But throughout our work on One Health, we've developed quite a lot of things that might be of use for your information and your continued learning journey. So I hope this provides some use, and I hope that what I just said today rings some bells and gives you ideas as you work towards this competition. Thank you very much.
Thank you so much, Ms. Manon, for the very engaging and insightful information. I couldn't agree more with you that the workforce can help prevent and detect and respond to all pandemic with the power of the working with the community. This is the core of this webinar as well. So now many of you may be thinking, I understand the problem now. The example from Ms. Manon and FAO, but how do I turn my idea into the strong project? So upcoming next section is design, especially for you, because this session will be very helpful for those of you who are planning to apply for the student competition. It is my great pleasure to invite Dr. Thongkorn Meyan, Executive Director of SEAOHUN Secretariat, to share her insight and practical guidance. Dr. Thongkorn, please come.
Okay, thank you so much. Okay, so I hope my slide go through and we'll see.
Yes, but can you make it in a full screen, Ka?
I'm sorry, it's already full screen in front of me. So let me try again.
Yes, please try again. I think Yep, I think you need to
Not
click.
yet?
No, not yet. I think you need to click with the full screen and then it will pop it up. I'm not sure what happened.
All right.
Yes, beautiful, perfect.
Okay. So thank you so much, and thank you everyone for spending the evening time together. And I think we hear a very good example from the FAO that has a lot of project implementing in the region right now. So you are now probably thinking like, how should we start thinking about the project? And let me just guide you through a little bit of process. So it's not a lecture, but trying to inspiring and try to help you how to start with the writing with the proposal. And it just a rough idea on the step that we have to start thinking about the shaping the idea. So what how can we thinking of like how should we design the project, and then you can start forming the team and then trying to design and develop the high impact proposal. To thinking about the idea, maybe let's say we can start from step one. We need to identify a cross-sector health problem. So it's not something that coming from your preference, let's say. It can be your preference, but the good project will be coming from a social problem. And because in this call, we will focus on One Health, which actually consists of human, animal, environmental health interface. So we share the same goal as the health problem, which is always complex and has a multi-driven issues. So if you can identify any health problem, so you might think of if that problem have the interface between human animal and environment, and sometimes we call it ecosystem. It doesn't mean the environment doesn't mean just tree and water. It can be a community, society, or even in the broader meanings. And One Health approach is always be useful to address the health problem that have a very complex and a multi-driven issues. So if you can think of any, or you are interested of any health issues that be in the community, you might think, is it a complex and multi-driven? So if it complex, it means like we cannot solve it by one single solution. And that will be easy to solve, but it's more complicated and affect many people, many stakeholders, many sectors, and can affect to many can be individual or organization or institution. And of course, it should be aligned with the calls. But in this call, we make it very broad because we intentionally would like to encourage and use power, the power of youth, to engage with the community. And we found it's always powerful. But we are not intend to, it will be good that you probably identify the communities or the health problem that is surrounding or close to the university, close to the campus. I didn't intention because every student will have a very be realistic, like you will have a lot of a schedule, study schedule that is already fully booked for doing something that need a lot of travel. Long distance might not make sense, but make something that can influence your neighborhood, a community that's around you might be make more sense. So try to balance with the feasibility, align with the call, the priority and interest. And it's not just your interest, it should be the interest of the community or the study site that we would like to implement. So once you can identify the health problem that has that would require the One Health approach, then you need to start with the evidence, not the assumption. So what is the baseline data? What is the current situation that is available? If there are any incidents, prevalence, or any statistic that is available already right now, or any kind of information, then you can identify what is the gaps and needs for the existing system or for the current situation. So trying to be stick or using the evidence base, not the assumption or not the like we are not guessing. Then after that, you might need to see and show why this problem matters. So it's like what is the impact of this problem? Who is going to affect on this problem and how? What would happen if we're doing nothing on this situation? And what is the which system is failing? Is it going to being worse? After that, then you will look for the gaps and weak of the existing system. Is it the weak of surveillance system, the lack of coordinating within across sectors, across discipline? Is it the limited of capacity, either the laboratory capacity or the educational knowledge of the villagers? Is it the poor biosecurity or waste management or lack of community awareness? So this is just the example, like how you look at that problem. So be more practical. And then we need to be realistic that to ensure that the problem is achievable and be able to address, because the student competition, we are not expect a very long-term or a very long-range project. It will be very short to give you a chance to exercise and bringing your theory to the community and can influence the community. So it should be small enough, not too big, small enough to solve and influence and make something meaningful. But it has to be big enough to matters, not just to funder, but it's big enough to be able to improve or matter to the community that you are trying to work with. And it has to be feasible. The project is very short, and you do it as the extracurriculum activity. So trying to be more realistic and more feasible. And you need to also trying to be understand your capacity, the group of the student you working, who is the partner, what skills you have, what is the resource that available right now that you are really able to do it. So let me just give a very rough example. For example, if you're thinking of the health problem, if you say like, okay, we're interested in rabies in communities, right? So then you have to think, if rabies in community, is it a problem in this community? And is it priority for this community? Sometimes it's your interest, but not interest of the community. They don't see the values. I believe Manon can have the feeling that, so if you have if you can engage with community, so the implementing would be much more smooth and easier. So it has to be the interest of the communities also. So our partner has to have the same priority and interest. And then, is it complex and multi-driven issue? Does it need One Health approach, right? So rabies is zoonotic, transmitted from mammals to humans, and so there's a lot of strategy to control, right? It's not just veterinarian or human doctors or the local government that get involved. It might affect more people. If some area might be affected to tourist spot, that is also an issue also. Then if you able to identify the health problem, then we can start with evidence. So if there is any what is the current situation, right? Is there in incidence or prevalence available? What is the current policy or implementation that has been done in the region, or any law or regulation to control? Is there any data from number of animals in the region or in that area, let's say? And then you can say, is it a gap? Is that matter? Is that how big is that problem? So is that impact to economic? Is that impact to public health? If you're doing nothing, what is going to happen next, right? And then you might look in at what's wrong with rabies. Is it the question of lacking of the awareness of community, or do not have enough knowledge, or lack of information that you're trying to fill the gap, or trying to improve that system? And then if you find a solution, or having some innovative or some initiative that you like to implement, you need to see also that is it feasible? If you plan to do vaccination, for example, do you authorized to do that? So you need to be graduate before doing some vaccination or doing some surgery for dog population control, or you get support from the veterinarian to support you in the activity. So that's something that you need to concern. Within a short period, is it feasible to do all of these, or awareness raising? So it has to be you also need to show that that the One Health approach is better than the conventional one. So something that is more complement to one discipline approach. So this is the idea, and how to like starting and drafting to shaping, framing your idea at the beginning. And then you might be forming the One Health team, but I understand you might already have the student club in the university or in the country. But you might think like for the idea that you have, framing the problem, trying to develop the idea for the solution and approach. Do we have enough experts? Do we need to engage more expert across sector? So there's two terms. So one is the discipline. So it means you have different professional, right? Animal, human health, environment. But if we are talking about across sector, it will be across institution. Like if you're in university, do you need to engage with the local government, local authority? You want to engage with the head of villages? So that is across sector. Is that required, or is that useful in the project? Then you probably need to start doing that and checking to do some co-design and engage them for role and responsibility. And I think that this one would be very powerful approach to start doing some initiative in the communities. And then you need to keep communication and share decision making. So what, after you got the ideas, what make a good proposal, right? So the first step, we already talking about that in details. There's a clear problem and justification, how to shape your idea. So once you get a very clear problem and idea, and I think you can use flowchart to help draft or drawing your idea. I think it's help rather than a lot of text. I mean, like to help framing your own concept. So there will be a problem statement, and stick with that flowchart and stick with that picture and try to explain it very clearly and concise. So our template is not very long. It's not a full proposal. It's just a concept note. We would like to have a concise one, the very clear and concise one, what you would like to do, what is the problem, to see your idea. You do not need to write a very long proposal. Then I think you have seen this one a little bit. It will be the same as the research objectives. The SMART objective, more specific, measurable, achievable, relevant, and time-bound. A good objective will need all of these 5 components in the objectives, and that helps because when you design the methodologies, then you need to answer all of the objectives very clearly. So then measurable, specific. So these 5 will be help you guide through the methodologies also. Then you need to look at the integrative approach with co-creation, co-design. You have probably have those experience, and we are looking for hearing more example from Dr. Inda in the next presentation. But I think the methodology in this call would be really important to have a multidiscipline, to have more, let's say, a different perspective to approach one problem. The last one, this might be too much for the student project, but if you can add it, you can think it a little bit ahead for the sustainability and scalability plan. So sustainability means what will happen after the project ends. So you're not going to spending time and money in the community, and when you left and nothing improve or happen or continue. So trying to think about this, and you might be able to adjust your approach and your methodology a little bit to help the project continue after the project end or be endorsed by the authority that responsible for the community. And the scalability, is it be able to replicate? So if the scaling it up, not necessary, it's just the optional in this call, but it probably good and be a little bit for your exercise to think about this one a little bit. So if the project end, what happened after the project end? And if they would like to continue doing it, is it possible to repeat it? Or is it possible to scale it up, make it broader, make it bigger from this small project? So that would be a very good proposal. So this is one example of the objective with the SMART objective. I just put it for your reference. So it can say like we will establish. So this is not, doesn't need to be your objective. This is really example. So the establish a One Health Rabies coordination committee with quarterly meetings. So it's specific enough. So you're not saying you want to improve the knowledge. You want to improve the One Health knowledge. So it cannot be measured, right? So something that be able to measure and specific enough to measure and design. So this is the proposal components, and I think probably Fai and Tura might talk about this later on. But just to show you that we might have it different in our template, but we need it more concise. Yeah, to develop the proposal component. So I share this PowerPoint later on so that you can use it as a reference later. And this is the summarized of the slide. So I think the most difficult one is to start. So start and validate the problem first, and then you draft the concept, review, is it feasible, is it possible? You get the commitment and engagement with the community, they agree, and then you can submit to the donor or to us in this case. So this is end of my presentation, and I think we continue with another example with Dr. Inda. So back to you, Fai.
Thank you so much, Dr. Tongkorn, for those very practical and useful tips. I would like to draw each of you back to the questions when we start is, have you ever looked at the problem in your community and thought, I wish I could do something about this? So the gap for the real problem that you wish to solve for your own community is very important, and maybe help you to get some ideas after listening to this session. Before I move to Dr. Nuinda, I would like to have you to maybe if you have some questions right now for our speaker, please feel free to drop those question into the chat box. Maybe one of you have already have a topics in your mind and not sure, you can also ask Dr. Thongkorn, is that this is good for, for the first initiative idea, something like that. So now let's move from the idea to the real action. You will hear example of student lead projects and how collaboration can turn simple idea into meaningful change. This session will also highlight the important roles of youth and university in addressing world health challenges. So this is my pleasure to invite Dr. Nuinda Ahmed, coordinator of SEAOHUN, or Malaysia One Health University Network. Dr. Nuinda, the floor is yours.
Thank you very much. Bye. Can you hear me well?
Yes.
Okay, all right. Thank you. Okay, the slides are up. It's okay, bye? All right.
Yes, okay, wonderful.
Okay, thank you. All right, so good evening, everyone. So I'm going to share a few of the examples from the experience of the students under the Malaysia One Health University Network, who had been conducting programs and activities, collaborating with communities and certain other parties. So let's dive in. This is just to, bring us all back to the picture while we are here. We are happy to be part of SEAOHUN umbrella because it's a very unique and diverse region. As Ms. Menon mentioned just now, we are located in the hotspots of the zoonotic diseases and potential emerging diseases in the future. So it's only logic to also be prepared with our future workforce, which are all of the youth, the students who are present today. So the PDR, prevent, detect, and respond to emerging and neglected disease threats, are at the core of most of our activities, driving the student-led activities as well. And as we can see here, the Swiss cheese model, which we might have seen a lot through the COVID-19 era. So these are the things when trying to illustrate to students, like each and every layers, preventive measures, steps, control measures, communication. So all of these involves a holistic method and approach. That means the One Health approach. Okay, so we cannot be in silo and work alone. And the same goes to activities as well. And when conducting all of these, planning all of these activities, when trying to translate the One Health classroom knowledge into action, definitely you can also align with the SEAOHUN's One Health core and technical competencies, as you can see here, which is also available on SEAOHUN's website as well. And so all of this, like the sharing that I'm going to be mentioned just now will be mainly from student clubs, but also from other initiatives involving the students within the SEAOHUN network. Right. So in Malaysia, we have I think a total of 9 One Health student clubs in 9 different universities. And they come from different backgrounds, from the medical backgrounds, veterinary backgrounds mainly. And we often encourage them to also incorporate students that does not come from the medical or veterinary backgrounds in their activity. And this is one of the examples that I'm pulling out. There's plenty of other One Health Student Club activities that's conducted. I saw Dr. Naim and Dr. Sandy joining the call today. So they themselves within their universities have conducted many wonderful activities. And this one over here, it's the south of the border. So it's a program with the Club Alami in Johor, in the southern peninsula Malaysia, whereby it's the fishing village community living along also nearby the mangrove area within the southernmost state in Peninsular Malaysia, neighboring with Singapore. So this was conducted in 2022, and it all began when the students were trying to come up with idea of how, because most of them are vet students in the club. So they wanted to reach out to somebody who's not from the animal health background. And so it began with a webinar where they invited Dr. Serena Rahman, who is the founder and also the advisor for this, they call it Club Alami. If I translate it directly, it will come as Nature Club in Tanjung Kupang. So her expertise is on climate change, community, citizen science, and environmental education. And we also had two guest lecturers, Dr. Gary and also Dr. Deborah, the One Health Lessons founder. And then we had students to IBSA, Miss Waibatul Anisa. So during this webinar, the students wanted to get more combination of inputs from the peers, which is coming in from the IBSA, Miss Waibatul Anisa, and also from experts from outside of the university. And so through connections and whatnot, so we have managed to get all of these experts and invited speakers who did a wonderful job in delivering and making sure that the students were then, most of them were vet students, so they are able to then see how they can actually work together with people from different backgrounds. So after that, they were inspired very much by Dr. Serena, and then so they wanted to go to her place in Tanjung Kupang, Johor, and this is her. So the students wanted to do something outdoor as well. Okay, so because they want to get to know, go closer to the to outdoors and to the environment, to nature, and so this is them with Dr. Serena. So we had like a campsite outside her club facility, and over here, the first part was the club welcoming us, the community welcoming us, and then they showed around. And what's interesting is that all of these walk around in the mangrove exploration area is actually led and guided by the youth from the area as well. So it's basically the youth were empowered by Dr. Serena, and then the student club were then, over there, they learn so many new things when they step their foot into the mangrove. So they are trying to see it from a more bigger perspective of One Health. And then also they interacted with their children and youths from the fishing village area. And as you can see back there, there's actually the port, and then that's also Singapore. So this area was chosen because of the interesting intersection between a busy part, Singapore, the developed area, and then also over here and this Malaysian side where we have this mangrove area, fishing village still thriving, and we learn how they are actually trying to thrive and survive despite the changes in the landscape around them. So, and then there was also a moment whereby we call it the entomology moment, where the students, the student club, were also learning about the different types of insects, especially that live in the area at night time on the campsite. And they also learned it from the youth who were trained from the area, trained by Dr. Serena to archive, to learn about the species, and then where they live and the characteristics of it. So this is very much fun for especially for the vet students. And then there were also components of giving back to society as well. So they helped in terms of the charity and volunteerism. So stepping out of the usual medical background, health background. So they learned to do a bit of a CSR, social responsibility. So they helped to wash some of the clothes which were still in a good condition, which can then be given away to those in the area. And then giving back to the society, also giving back to planet, to the earth. So a component of for the tree huggers, not necessarily tree huggers, but also for them to appreciate every tiny step that they do, whatever activity, whatever action that they do counts. Whether giving back to society, to the environment, to their peers, to the community, so to the animals in the area also, so it all will come a long way. Okay, so they hopefully they appreciated that the activity, and then also it kind of like becomes like a two-prong or a three-prong activity area as well, because at the end of it, they also had community engagement with the children, specifically, because they had fun with art activities. So they're trying to do it in the form of storytelling, handwork, artwork activities with the young children to explain them about nature, to explain a bit on the basic concepts of One Health without the technical jargons. So yes, and at the same time, the university students were able to learn how to approach the different stages of different groups, target groups, because it's not just talking to the medical peers. They're not talking just to the lecturers, but also talking to members of the community and this time around it's at a very young age, the children. So this is, I think, a very good aspect or component of activity. So just wanted to highlight that whenever you want to do activities with children, obviously you would have to have written consent and consent from the guardian. So time and time again, we also reminded the students when they are actually planning for it. And so this is it for the activity. And then I think aligning those activities that was conducted during that program, there were plenty of it that you can actually match to what the activities were, especially when you talk about culture, belief, values, and ethics, communication, collaboration, partnership. So I think they appreciated that a lot. And obviously leadership and management when they are trying to and when they are planning the whole activity. And then I'm going to pull out just a few other examples. So this One Health ambassador, they also conducted like a TOT in the first part, training of trainers, and then they continued with a community outreach program on zoonotic diseases in the second phase, and then in the third phase, they did a community outreach program again in an orphanage. And they also have rabies run in 2019. So this is targeting members of the public, especially those coming in from other other faculties in the university. So it's to raise awareness on rabies in a fun way and a healthier way as well. And then, there's other examples from UMK. They did a One Health Day activity, World Zoonosis Day infographic competition. So it can come in many forms and you can actually plug and play, mix and match those elements. And as what Dr. Tip mentioned just now, some of you may want to do something to do with rabies. And then probably, this one we had the opportunity to collaborate with Boehringer Ingelheim through their flagship activities, which is Stop Rabies. And some of the students were fortunate to be tagging along and then joining the vaccination campaign and also community education campaign on rabies. So it starts in the classroom and it goes back to the community. So it's a good One Health activity example. So there's all culture, values, belief, and ethics, interacting with the local communities. And then there's also working cross sectors with the Ministry of Health, the Department of Veterinary Services, and then with the school children as well over there. So this was a very good activity example. So not necessarily, in terms of the target and whatnot, as Dr. Tip mentioned just now, you will have to scale to the capacity. Okay, so you are all able to do wonderful things, but then you can shape things from your perspectives based on what you are capable at this moment in time, acknowledging all the limitations. Sorry. So this is the Rabies Stop Rabies activity program. And then lastly is on the experiential learning with indigenous community as well. As Ms. Manon mentioned just now, when you have the people living in areas like close to the wildlife habitats. So this is one of the examples, the indigenous community in Malaysia, in Perak. So during this activity, we bring the university students from various backgrounds. So we have law, medic, students, education, architecture, and engineering. So they would be, in the beginning, they were all a bit puzzled, like, why do you lump all of us together in one place in a remote area? And then they found out why, and then through a very fun and beneficial experience. So we had to travel into the outdoors. So I think being in the outdoors in the community is one of the example of things that would be very useful, beneficial, and attractive to your peers to actually join you in the adventure. And then so there's always a component element of giving back. So it's not just you enjoying nature and whatnot, but also giving back to the community. So over there we talked about shared about the basic 101s on germs, zoonosis, again without the technical jargons, and preventive measures through fun interactive sessions. And this was also conducted after the pandemic era MCO. So that's why you see lots of face masks over there. But yeah, we definitely had fun with the indigenous community, and then vice versa. So it's like in a relationship, it's not just you making sure that you're showing that you are contributing to the society, but also, taking in the lessons that you actually learn from the community over there. And this is also one of the example of exchange of information, knowledge. So the students learn about the language, local dialect and language of the indigenous community on basic languages, basic commands. So it was really good to see them break the ice through this. So that's one important part of culture, belief, values, ethics, and also communication that the students were able to learn. And yeah, this program is specifically designed by Prof. Dr. Abdul Rashid Han. Okay, so yes, so One Health for All. I think turn your plan into action. Have fun, but not just fun. So make sure both of you, I mean, the community, the society, whichever stakeholders that you're actually dealing with, give back to society, animals, and planet Earth. So thank you very much. That's all from me. Bye.
Thank you so much, Dr. Inda, for a very excited presentation. I actually like the rabies run. So you can
Yeah.
also like have activities, also the healthy things that
Yep.
you can do in a community as well. And I want to echo to your presentation that creative is very important. And please don't lose the sense of the young generation. You can do something that fun, think out of your comfort zone and off the box, and try to do something that can draw attention from the community. It would be amazing. So I would like to take this opportunity to express our sincere appreciation to all our distinguished speaker, Dr. Philip Clay, Dr. Thonggon Miyam, Ms. Manon, Dr. Nuinda Ahmed for your insightful and inspiring presentation today. We truly appreciate your time and your valuable contribution to this session. All right, back to our purpose of today program. So let me share my slides because we're gonna back to the purpose of the webinar that we will launch the regional student competition, which means we will dive deep into it. Okay. All right, before we go into the competition, let me briefly share about the SEAOHUN Student Engagement Program. So this program encourages students like you to apply the One Health approach or One Health concept to the real world challenges. It's not just about learning in the classroom, but it's about working together across discipline, building both technical and soft skills, and become future One Health leaders. Okay, so this is this year theme that you can see that we have the theme of the regional competition is about One Health Campus to Community Challenge, or you can call OC2C because I really like it. It's One Health Campus to Community Challenges. So it is the student-led competition that support community-based project. So you and your team will decide a project that applies to One Health ideas to solve the real local problems, connecting to your student, or not your student, your university knowledge with the community needs. So we want to see students become implementer from the campus to the community. So you can see it here. So it started from campus where student and university work together across discipline. And then second, we go to the bridge. So where you apply what you have learned to real life community challenges. And then the third, we go to community where your project creates real impact for people, animal, and environment. So it's about moving from learning to action. So the key information, duration, grants, teams, this is very simple. Your project will run for about 4 to 5 months. Up to 9 teams will be selected. I wish and I hope you will be lucky to win some of the grants that we provide. And each team can receive up to $2,000 in funding support. So I want to thanks to Chevron once again for the funding support. This funding is to help you to implement your project in the community. So now is who can apply. So this competition is open to the student teams or student One Health Student Club. So you can go and check the club, and the university is the member of the SEAOHUN and the SEAOHUN websites. And from SEAOHUN member university in Southeast Asia as well as India and Bangladesh is also included. So each team should include students from at least 2 different disciplines. And have at least 1 academic mentor. Complete at least 1 SEAOHUN online course, which is we will talk more about it because our SEAOHUN program manager is also here. So he will draw you and then guide you to how you can complete the SEAOHUN course as well. And your project should reach at least 50 community members. So teamwork and collaboration are very important here. So you can choose many different topics as long as they related to One Health. So this is just only example, includes zoonotic diseases like rabies or even influenza, Nipah virus right now, malaria, dengue, that happen in your community. Antimicrobial resistance or AMR, environmental health and climate change, food safety and agri-food system that you have heard from Ms. Manon, that maybe you can have an idea that to work or expand your idea across these topics, or community surveillance and risk communication, or even this day, right now, our generation like to explore with the AI in One Health and use the digital innovation to develop out the project in the community. You also can. So we really encourage creative and community-focused idea for your proposal. So your proposal would be evaluated based on these 8 criteria. Some key points it will be include like, is your project relevant and important? And is this a real issue in your community? Instead of choosing a very general topic like health awareness, you can do something that more focused and very specific. Is your idea innovative? We are looking for something that creative solution, not just repeating existing activities. Instead of only give a lecture, you can use for example, mobile apps, short videos, or interactive game to educate your community. Is your plan clear and realistic? Your project should be within 4 to 5 months. I know like some of you may be thinking like maybe a year, but sorry, we'll have like only 4 to 5 months that you'll have to complete and hand us a report letter. So just to make sure that it's clear and realistic, like not just targeting one village with 50 participants is more realistic than you trying to reach an entire province. If you can do it, it's awesome, but it's really hard. I think maybe you need to rethink it again. Budget cost effective, this is also important. Maybe you can engage with the other discipline like business, faculty of business or something to help you with this. With the budget should be clear and reasonable, explain clearly how much for the material, how much for the travel cost. Each cost is necessary, but avoid unclear and very high expenses without explanation. That is engage with the community. This is very important. Does your team show interdisciplinary collaboration as well? The strong team should include a math student, veterinary student, environmental or social science student. Like example of Dr. Norinda, maybe you engage with engineering or architect or business, I don't know, just to make your teams work together. And of course, and it's a plus if your project can scalability and sustainability would be amazing. So it depends on your ideas and also gender and social inclusion. Make sure that your project includes different groups in the community. Okay, next is the key dates. It's very important here. So I suggest you to make a note on it because we cannot have a long project like a year running up. So you have to make sure that you finish and submit the report within the month that we give you as an idea here. The deadline of the application is on the 3rd of April. I hope that I can see many and various proposal is from you across this region and also India and Bangladesh as well. And also the final reporting and showcase will be around September to November. So to make sure you prepare your proposal early. And last one will be how to apply it. I'm sure that you're here today, maybe some of you already explore and study about the competition. So how to apply is very simple. You just go to SEAOHUN website and I will drop the link later and download the proposal budget and work plan template. And then you have to complete the online application form and upload your documents. Make sure at least one of your team member completes the SEAOHUN course. Everything must be submitted online. And then it will come to us. We will have a file review and then we'll announce it as soon as it's gone through the committee or judge across the region as well. So I will have the PDF drop into the website as well so you can download anytime. So last one, the last one is if the team is selected, here is what you need to do. I don't want to see a commitment. I will say it's like agreement. So we'll join an orientation session to celebrate for the 19 winners. Implement your project within 4 to 5 months. Join the regular monitoring session, maybe when we required. Submit progress updates if needed, and then submit a final report. And participate in a regional sharing activity, which is likely to be in November. So this is not just a competition, but is a full learning experience. So my name is Jutamani Arya. If it's too long to remember, you can call me Fi for short. Feel free to email me and ask any questions. We are here to help you, and don't be afraid to try. And then don't have the language as a barrier for you to experience the new things. Yeah. All right. I want to hand it over to Tura about the. He can talk a little bit about the SEAOHUN. Tura, are you ready? I think you mute.
Sorry. You can hear me,
Okay.
right?
Okay. Yeah. Nice and clear. So I share the floor with you.
Thank you. I know that we are a little bit behind the time, so I won't take too long, and we can. You can reach out to me later if you have any questions. I just share my screen. Can you see my screen?
Yes.
Okay, great. And I also share the link, the URL link of this website. SEAOHUN Online Academy, the South Asia One Workforce Academy. We call it like SEAOHUN, right? So I share the link in the chat, and you may explore yourself if you never, saw this site before. So if you click on the link, you will reach to this site, and I won't take too much time. I just would like to focus on the course completion, right? Because it is important for your application. So, I mean, you go to the site and you will see the courses. I mean, if you are interested, you can explore all these available resources. But I just would like to focus this presentation on the online courses. So if you go to the courses, you should see the different courses in different languages because SEAOHUN is meant to promote the local learning. In the South Asia, we offer the courses in the different languages in South Asia. Like as you can see, this is Vietnamese and Lao, some Thai, some Khmer, some Bahasa. So I mean, if you're coming from those countries, I think it would be very great and convenient for you to join those courses in your language. But if you're not from the country, and if you are from, like, for example, from India or Bangladesh, and you want to apply, we also do have some English courses. Not a lot, but we have at least 3 or 4 right now in the platform. For example, like this one, you can learn this one, like the integrated health surveillance system. If you're into this subject, you can learn this one. Otherwise, you can try the Gender One Health or Lawa model course. And these are English courses that I'm talking about you. And this one also from Laos, but it offers in English. So I hope that you can learn this one as well. It's just teaching the basis of One Health concept. And it's like a simple short course, you know, it's not like a very long with the many modules. It's quite simple and basic course if you want to try this one as well. And also we're gonna have we're gonna launch the more English courses in next few days that we the very important courses like the fundamentals of One Health. So I also encourage you to join and enroll these courses like fundamentals of One Health if you are applying this grant, because I think that this fundamentals course will help you improve your One Health knowledge and also give you more ideas to draft your proposal in terms of engaging multi-sectoral, multi-stakeholder proposal. And to enroll in the courses in this platform, you need to register. You saw the register, right? So you have to click the register and you fill the information there. After registration, you should be able to enroll any courses in the platform. And it is free. It is free of charge. So please feel free to enroll if the courses are interested for you. And we just launched this online e-learning platform like few months back. So I mean, in case you experience any any bugs or any issue in the platform or in your course learning, please feel free to reach out to us. You can raise your ticket here. I hope you can see my screen. So you click the help button and you should have a ticket session, right? So you put your name, you put your email, and you put your subject. Like for example, I cannot generate my certificate, although I finish my course less module or final quiz. That's your issue, right? So you put the subject, you share your issue here. And we also request you take a screenshot picture of your, issue, right? The page that you are stuck or the page that you cannot proceed to the generation of certificate or something like that. In case that happens, so you put the screenshot and you attach that and you submit the button. Then our IT will monitor and try to address and solve your issues, right? And otherwise, if you have any like kind of programmatic discussion or any consultation or any discussion that you want to make, you can reach out to me as well. I will drop my email in the chat. I mean, for example, like you are from, I don't know, you are from Indonesia and you are like a vet student, final year, but you don't know which online course that you should join. So if you want our advice, we can help you what will be the best course for you in case you need that guidance. But I mean, I don't think so. I think you can be you are able to explore yourself in their website and you can choose the course whatever is most relevant and more useful for you. I think that's all for my presentation. you can reach out to me and I will drop my email in the chat. I think we also have some question to address. Let me over to be fine.
Thank you, Tura, for insightful. And that, as you can see, CEO are available in local language as well, and also in English. So Bangladesh and India student, you don't need to worry about it. So you can go and explore the courses that's available for you. So it's come to almost closing. So we're gonna go to the Q&A. I would like to have Dr. Tongkon to be upfront so she can answer the questions in here. So first questions from Mr. Nin Chin Lai ask, who should head the project, the student or the supervisor? You want me to answer? Okay.
But I'm waiting if Tura would like to answer. You want me to answer?
Okay, so you, yeah.
So let's go ahead. For the project leader, so we expect to have a student who leads the project. However, we request the supervisor as the faculty member. And later on, I think we will have the orientation session if we probably need to sign contract with the supervisor instead of the student. But if you see the template, the project leader should be student, project supervisor should be the faculty member, and the team member can be a student.
Thank you so much. Next questions from Mr. Ngong Yuan Bao. Sorry if I mispronounced. May I ask how many students should be in the team? You have minimums?
So I think, well, I thank you for the question. I think we can improve the template, and I think if I can add this information, what I've answered to the template also. So the team member can be, well, there is not minimum or maximum, but let's say we suggest to have like 3 to 5. I understand when you having the activity, you might have a lot of student engaging, but try to identify the key person to show as you have involvement from multidiscipline. You don't need to add everybody to the team member, just the key person.
Okay, thank you. For the third question from Manudun Hassan, I think he's maybe from Bangladesh, he's asked, is he still eligible for the Rohingya from the Bangladesh refugee camps to apply for this?
Well, actually, for this round, we so I'm not really sure. Actually, we try to focus on the student. So if you have student status at the university, then at the Bangladesh university, then it will be that you will be eligible. But if not, so we are not open for NGO, CSO, or general public. So we focus on the student at university level at this time, and we might need the Bangladesh University as the like your host organization.
Yes, thank you so much. Next, from the Sonita Meng, she asked the 3 questions. First, beside the mentor, can consultants also be included as members? First. The second, for the budget section, do we need to obtain quotation for the expenses that exceed a certain amount for this stage? And regarding travel cost, is there any set rate per kilometer as well? And third, if a member comes from the same university but different faculty, does that count as a multidisciplinary? Thank you.
So there's a lot of questions then. So for the first question, I would suggest that the faculty member should be act as the supervisor. And if you have 2 supervisors, please feel free to list that. So supervisor can have more than one person, and team members should be student because we actually focus on student group of the student team or student club. So we would like to see the team member from the student. But like I told you, as the student or team member, if you get more involvement from a faculty member, so please list in the project supervisor. But if you have if you have like 3 or 4 faculty members joining the activity, you don't need to put everybody here. We just need to have the key or contact person to be listed in the concept note here. For the second question, we do not request any quotation at this stage. We might request you later if you get selected later on. And the travel cost, normally we will refer or asking reference from the institution. Like if you're coming from a university, then it has to be using the regulations from university as the reference. And of course, when we evaluate the proposal, so we will look at the cost effective also. So what you put it here, if it doesn't make sense, then it probably be justify as not cost effective and just share. But we were not looking at the any supportive document at this stage. For the third question, if the member coming from same university but different faculty, so we are looking for the discipline rather than the university. And I think in each country you have different types of student clubs. So you might have same university or different university, just looking at the professionals area.
Okay, thank you. So Mystic Bachelor asking about the numbers. I think I can repeat from Dr. Tongkorn earlier. Is we will recommend is 3 to 5, so you can have a team manageable for the team activities, and the time frame have to be within 4 to 5 months of the implementation. So next question from Arjun Rakime. I have 3 questions. What is the maximum number of the team? This is already answer and have to excluding the mentor. Just to confirm, participate from department such as law or engineering eligible to join the team. And then last one will be will biochemistry, microbiology, and biotechnology is be considered as multidisciplinary.
So I think you get the first question already. For the second question, yes, if you having law or engineering join the team, it's fine, but you probably had to be related to the topic, right? So if they are engineering or law, so it has to be clear what is the role. So if the topic or the issues that you identify need the engineering and law expertise, then they can join the team and just define as the one discipline. For biochemistry, microbiology, biotechnologies, be considered as multidisciplinary. Well, if you look at the details, so there are overlap, right? So the expertise is overlap, but I would not stick to the name of the discipline, but I will let's see if that is you have different perspective or how they contribute to the project. So I think we will look at that aspect rather than the name of the expertise. So if your project is very deep in detail, so deep in that biochemistry science and have a kind of many aspects to need a lot of differentiate between those 3, then then it's multidiscipline. But if you just add it just for having the multidiscipline and without the career role, I think then it will not count, let's say.
Thank you so much. And next question from Hasmin. The only member university in the regional SEAOHUN counterpart are only allowed to join the proposal. This one I think I can answer. So yes, and also we will welcome for the Indian Bangladesh as well. That's why becoming SEAOHUN member is a privilege to join the program. Next is Mahadun Hassad. They say, yes, we are Rohingya students are currently studying at the Bangladesh University in the several university. If so, we can eligible for it, right? Yes.
Yes.
And each student academician lead the project must get the certification before apply the grant. One representative is enough.
I think I will check this one with Tura. I'm not sure how would you write it now.
Yeah, I can address this one. If this is about the online course completion, if the question is about online course completion, I would like to refer to the clause that we have in the call for proposal document. I hope that you already read that one. In the eligible criteria, we say that at least one team member from the applying student teams must complete a minimum of one health online course from the SEAOHUN platform. Certificate of completion will be required in the application. So it means that at least one from your team member has to complete at least one online course from the platform that I show. And it doesn't need to be the team leader. It can be anyone from your team, at least one team member. So that this team member, I mean, for example, if the team leader is not, cannot finish the online course in time because he's leading the proposal, right? So someone's taking the online course. So later, when you design the proposal or when you implement the proposal, the one who learn the fundamentals of One Health online course can advise the team what he or she learned from the online course. So that is, the objective that we at this class. So my answer is that only one team member needs to complete one online course from the platform. And yes, you have to complete that before the grant application. And because you have to attach the certificate in your application. If you have, additional questions, you may put in the chat. Thank you. Over.
Okay, thank you, Tura. So let's move to Mr. Renzo. Are we allowed to collaborate with the from the member coming from other university, but in the same province of the community?
Yes. Actually, it's fine. Actually, it's good also to have the link, a group of students, so we are not limited to only one university.
Okay, thank you. And from Mystic as well, more question for the community outreach. What is the maximum number of the communities that I will visit? Do you mean by the target community numbers? If then at least we have a number of at least minimum is 50 community members that will join your activities, but make it realistic and feasible. You're not gonna go to entire province, something like that within 4 to 5 months. You have to make it more like realistic as well for your proposal. And then please share today presentation. Yes, of course, I will put the link in here so you can go to the webinar page of SEAOHUN. I will put the presentation of myself, Dr. Thongkorn, Dr. Nuinda, and then Ms. Manon as well. Any more questions? With the feedback link, I'm not sure about it. If you want to give a feedback for the webinar, just send it to myself or info@seaohun.org. So we will welcome all the feedback from the for the webinar. Any more questions? I think today's session is very engaging. feel free to drop it. And if anyone have to go home or something, please feel free to leave as well. We'll try to answer as much as we can. This is the link to access for the presentation. We will drop the PowerPoint presentation in here in the PDF file, so you can access to it. All right, I think it's over time a little bit, sorry. But before we close, I just want to hear the remark from Dr. Thongkorn, a little bit, very short, please.
I didn't plan for the remark actually, but I would like to thank everyone, Manon and Inda, who helps joining the call, and I've seen Christine as a familiar names here. So thank you for joining, and so hopefully we continue and making progress and engage with youth. Other student to like inspiring the student, inspiring the community, and to see like to make a difference in another day. So thank you so much for joining, and thank you for supporting SEAOHUN.
Thank you so much. Thank you so much, our other speakers. So I think now this is your chance to turn your idea into the real action. Even a small idea can make a big difference. We are truly excited to see your creativity, your passion, and your solution. So don't be afraid to try. We are here to support you. Thank you so much for your time today, and we look forward to receiving your application. Have a good evening and have a good night. Thank you so much. Bye-bye.
Bye-bye.
Thank you, everyone. Bye-bye.
Bye bye.
Thank you. Bye bye.